program by Dr. Kannagi ma'am. Kannagi madam is one of the most senior practitioners, not age-wise, but experience-wise. And we're extremely lucky to have her as a speaker today. And I would like to welcome all the delegates who have joined today. A special welcome to Dr. Suchitra Pandit ma'am, who has joined from Mumbai, and Dr. Jayamkaran ma'am, who's joined from Chennai. And I'm seeing lots of friends from throughout the country. May I now request Dr. Manjula, the treasurer of the society, to introduce the speaker, Dr. Kannagi.
Good evening. Dr. Kannagi Uttarraj, madam. She did her graduation and post-graduation from MMC. She underwent training from Professor SSR. She's practicing AART since 1993. She's the director, Tamarai Fertility Centers. She's the COGS president, scientific chair, ISAR 2016, UFOXY 2019. She's the organizer, annual FET-OG Summit since 2002. She is the invited speaker, national and international conferences. Her research is about Y chromosome. She is the author in textbook of ART. She is a faculty dependent program in KMCH. She is the chairperson, Simford Trust. Madam is going to talk about A to Z of setting up a IVF clinic. Over to you, madam.
Okay, I'll share my screen. Yeah. First of all, let me thank the organizers of this Zoom meet, Dr. Chamila, Dr. James London, all real active members spreading knowledge right across the ARTs of the OG Society, especially in the fertility reading of fertility medicine. Now, coming to the why this topic, A to Z, and how to set up an ART lab. Initially, when I started the ART in 1993, there were only a couple of centers in even a big city like Coimbatore. And when we wanted to set up one, we had to seek help from outside. We just had to go train outside and bring in outsourced embryologists right from Australia and other countries, and to do this embryology, especially embryology work. Now, in 20 years or 25 years down the line, the whole scenario has changed. Even as I sit in Pollachi, on my same street, I have 3 ART centers here. So it is good that there are a lot of centers coming up, so the access for the services is easy for the patient, especially those who cannot afford to go to a main center for to travel long distances, and the additional cost of staying and spending time there. All that is done away with when you have centers right at the doorstep, close to the doorstep of the patient. But having said that, it does not mean that we just can convert 3 rooms into a fertility lab, because it doesn't work that way. The pregnancy rate will be very disappointing if we just go about it in a technical way of like doing an interior of a house. It's not like that. There are many more things there, and that's the point of discussion. I'm not going to go into the setting up of a very sophisticated high-end lab with all the facilities. That's another topic. But what is the basis of setting? What is the basis of each equipment? What is the thought behind everything? Is what is I will be delving upon mainly. So when you want to set up a lab, one of the first things you must choose a place. The place is very, very important. It should be ideally in a place where there's not much of traffic, not much of pollution, and even inside the hospital, it should not be in a very busy, trafficy area, or in a place like where they use like a main operation theater, where they have, they use a lot of Savlon and other materials for cleaning. All the odors will come into the lab. So you have to choose a sort of isolated place, and it should be free of traffic, smells, and any other toxic fumes. Then the second most important is the people, meaning the personnel. The personnel, we have two areas. One is the clinician, the IVF nurse, and if you can do the clinician does the scan herself or himself is fine. But sometimes you may have a scan person to do the scans, the sonologist. And coordination between these three is very essential. One more person in the clinic should be the IVF counselor. It's mandatory as per the new AART law that the couple should be counseled by an independent counselor. Then, having chosen the place, and then for the lab, you definitely need an experienced embryologist. Now, this is probably the bottleneck of the setting up the lab. So the embryologist has to be well experienced with good knowledge and should have scientific background of knowing what he or she is doing with the embryo, with this, and they should have a very good basic knowledge of biology and cell biology, especially, and of course along the biochemistry also should be an additional knowledge should be there. The equipment, of course, you have very good range of equipments you need, but among that, the important choices will be the incubator, and not one, but you may have to have two incubators, one as a backup. And there are different kinds of incubators. We'll come to that. The important ones are the incubator, the microscopes, the ICSI microscope, then the stereo microscope, and the microscopes for the andrology lab. These are the main, and of course, the laminar airflow tube, where the workstation with a heated bench. All these are the crucial equipments, and of course, the equipment for freezing and freezing equipment. So these are the main equipments. Apart from that, you will need so many other things like additional things like you should have a good UPS, aircon, and then the air handling unit, and so on and so forth. So it's not I just spoke about the main equipment you need. Then the training. So if in the initial period, it was difficult to get experienced embryologists. When we just started IVF in India, especially in Tamil Nadu, we had to outsource from different countries. We had from Australia, and she came in and stayed for a couple of months and trained our embryologists, trained them in a very good way, and up to the stage of ICSI, and then we could go on with our own staff. So this training is something very, very important, and they should have. Previously, we never had any accreditations, accredited trainings, but now there are a lot of centers offering accreditation and good training. So the people who come in should be accredited also as per the new laws. And even the training, once you get one person in good stand with a good skills, then that person can train the next level of people, junior embryologists, andrologists, all of them can sprout from this one well-trained embryologist. Having put all this in place, then you go to the execution, you have to plan the cycles. The clinician, of course, is responsible for the clinical part, the planning of the choice of patient, the counseling, and then the choice of protocol, the dosage of the drug, and handling any kind of, it doesn't have to go the expected way. There'll be so many unexpected turns the clinician should be able to handle that, as well as handle the ovarian hyperstimulation, if it is rare nowadays, but still can occur. So it should be, the clinician also should be equally well versed with all situations. Apart from this, it has to be a very safe lab. We hear of so many accidents nowadays, the fire accidents, the short circuit, etc. So fire safety, not only fire safety, chemicals, the liquid nitrogen, all the safety for the personnel, the safety from, if they are handling tissues, which or semen samples, which may have dangerous viruses. So all the safety measures you have to think and put in at every level so that the personnel are safe, the embryos, the eggs, all of them are in a safety net. And of course, you have the biggest headache will be the administration. You have to stitch all these patches together, and then you have a beautiful fabric in front of you. So that's the administration. So next you go on to the lab. Now, what the concept of an IVF lab? It's a mini. It's a mimic. It's a mimic of the. You mimic the ampulla of the fallopian tube. So what happens in the ampulla of the fallopian tube is going to happen in your lab. So your lab should be as clean, the cleanliness, free of toxins, free of particles, free of volatile organic compounds, free of bacteria, viruses, all living organisms. And not only it should be clean of all these what I mentioned, but also it should have the right pH, the right oxygen tension, the right mixture of whatever gases that are present in ampulla. The same atmosphere, you have to bring it into your lab. And this is probably the crux of getting pregnancies. The more you concentrate on the air quality, on all these factors, and bring in the correct pH, the correct gas mixtures, and the correct and the clean toxin-free room, your pregnancy rate will automatically go up. Contrary to the opposite. Now, suppose there's a painting going on in the next building, or there's a construction in the next, however much you shield, you will see a fall in the pregnancy rate. This is very practical thing. Don't get upset. We all have gone through that, any construction or painting, or even if you paint your own lab for the second time or so, your pregnancy rate will take a beating and take some time to get back. So we have to be aware of this air quality and how it can be affected by factors other than your own measures, even your own measures. It may be beyond you to control it, sometimes, not always. So this is one thing about maintaining the lab. So you have all these people, the sperm, the egg, and so all of them are involved. The counselor, the embryologist, the clinician, and then you have all these, and you get the good egg by your stimulation, and the embryologist chooses the best sperm, has the skill to inject it, and there you're with the good embryo, with a good genetically normal embryo, your pregnancy rate should come in. Of course, it's not 100%, but at least you match the international standards. Yeah, so this picture I put in there because the embryo is often a brat. Whatever you do, it may, it may go its own way. So you must be prepared for turns other than the normal. It's not always as in the books. It may go in its own style, but you have to manage it gently and take it across and see that you get it to the stage of transfer. Now, another important thing is you have to stick to the AART law, the surrogacy bill, and it's very explicit. Everything is, every word there should be read and practiced, because we cannot afford to bypass the law on any account, and we are being monitored as well. We should monitor ourselves, we should audit ourselves, but remember there is also the governmental agency coming in and checking in on every factor, every patient there. So there should be no deviation from the law. Formerly, there were only guidelines. Now we have the law in place, so we better follow this. Now, so the choice of place, how do you choose the place? The lab situation, it should be clean air. And the composition of, as I already said, the composition of the media and the air is similar to the human interior and the body, as well as the temperature also should match the body temperature. There should be no particles, no organisms, no toxins, and no traffic in that area. Of course, you cannot get an area like that, what you see in the picture, but try to choose one place which has fits at least more, in which most of the boxes are ticked. In the center, when I set it up in Kobe Medical Center in Coimbatore, it's a 5-story building. And when chairman told me to take any place I want, I chose the topmost 5th floor. And thanks to that, I don't have any traffic there. But one problem I have is they went on building so many things around. So often construction used to go on and it used to affect the pregnancy rates. But at least now things are finished all over and there's no more construction there. So the bottom line is choose something right at the top so you'll be free of the traffic, pollution, etc. The ideal, so I just put a plan here to show you the ideal setup. It could be a very small area that really, I mean, you don't need a huge area. What you have in a square, you can plan in very nicely. You see the green room, the waiting area, and the green area is the consultation and the scan and the IUI. So your entire OP comes in that rectangle, and you the entire IVF area is right at the behind, cordoned off from your OP area. And then you have the outside right on top, you can see the corridor, which is for the service, for the toilet and the staff lunch room, etc. And they have access because very often you have service personnel coming in for changing your cylinders, for servicing the air handling unit. So you give them a separate exit, separate corridor to access, so they don't come in and mess around with the lab. So that think of that and connect it to the air handling room. So the air handling room, of course, will be connected to the AART lab, and the cryo room can be attached to that. And this is the main area of the whole place, and that is why you don't put it right in front, zigzag the entrance, and take it right at the back, so that the traffic there is not, very little traffic is there. So then the lab has to have the theater attached. There has to be a pass window between the lab and the theater. And then you have the recovery area. So this unit is entirely, you enter, wash and scrub, and then only you enter this area. So it's away from the patient waiting area and your general OP. And so if you see the andrology lab, there's another problem is the collection room. Now the collection room has to be very close to the andrology lab, preferably with a pass window between the collection room and the andrology lab. So the patient does not have the embarrassment of carrying the sample around. And the collection room entry also should be not facing the waiting area, it should be away. So people don't, it should not be exposed to the people who are waiting there. And the andrology lab has to not only have a pass window with the collecting room, it should have a pass window with the ART lab and the IUI room. So there is no transit of the sample, no need for somebody to carry everything and run across. And so this may be you have to think of anything? So this is ideal. You have the recovery here from the theater and have a door. So if there is a crash situation, you can wheel the patient straight out instead of passing through all the rooms. So this would be an ideal plan. Of course, and if you look at what do you put in every how do you plan every room? On the right side, you have the theater, the table, an ordinary table would be fine, which can be with lithotomy rods. And you have the anesthetists and their equipment and tray, etc., at the head end. And you have the ultrasound on the right of the patient and the pump there, and your own operational tray here. So this is a very simple setup. And then you must have a pass window to connect the theater and the ART lab. The ART lab, the pass window should be lined, with stainless steel pass windows. They are custom made and they can have the warmers there. So when you aspirate the oocyte, you pass it on, but and you keep it immediately in the warmer. So there is no fluctuation of temperature for the oocyte. All along your procedure, you must remember that the oocyte can get damaged if there are fluctuations in temperature. So if you keep the tube outside for long and then pass it on to the warmer, this little, even a degree of temperature change or pH change can damage the oocyte and cannot give us a good result. So remember, from the time it comes out of the body till it goes into the laminar flow on the heated thing, the temperature should be maintained in a chain. So you have warmers, and it can go into the LAF will house the stereo microscope where they immediately see the oocytes, examine, separate them, and put them into the incubators. Preferably 2 incubators. You can have desktop also, the main incubator, which has a different gas, the triple gas. You can have CO2 incubators. All of them equally give good results. You have to keep testing their, keep them serviced well. So what they display as 6% CO2 or 5% is really 5%. So have them serviced often. And if there is any fall in pregnancy rate, you have to call the incubator people, make them go through a thorough check, the temperature and the CO2. Then you have the XC stage. This should be, you have all custom made now. It should be a non-vibratory table and the whole equipment can be on there. So this makes it comfortable for the embryologist to move between the laminar flow and the XC table and the incubators. So this is probably need not be a big space, but must be adequate for at least 2 to 3 people to move around. So, and then of course the ART lab is connected by a hatch to the embryology lab where the semen sample comes in. Then attached to the ART lab will be the cryo room. So the embryos can be taken into the cryo room and the process of vitrification can be done and storage can be in the adjacent room. So there can be an adjacent room adjacent to the ART lab for doing the cryopreservation. So I don't have the exact square what I described. So I have one wing having the theater, egg room and the thing, and the recovery, and the other wing having the IUI andrology staff at the genetic lab. So it's a slightly different way I could set up with what was available. It should have a wash area as well as a store area. And it must be very strict about the asepsis. We have to wash our feet, change fully, wear the caps and masks, and keep washing the hands often. And no toxic material. No one wears a perfume or whatever when you go into the thing. Sometimes patients come with strong body sprays and perfumes. I've had the experience of making them having a shower before I put them on the table for oocyte recovery. So all this should be kept in mind. Now, what about the air quality? This is probably the most important part of the whole. The air quality is very important for your pregnancy rate. Now, the outside air has a lot of particles which can be taken off by the HEPA filter. So your air handling unit will have a HEPA filter which will filter all the 5 micron size particles are all filtered. But the volatile organic components, they are gases. They will not be stopped by the HEPA filter. So they have to be taken off by interposing. They have to be filtered by interposing an activated carbon filters. So when they pass, the final air which comes out is almost particle free, and it is VOC, volatile organic component free. And how do you know that your air is good? So I've written there class 100. So this, when you have laser counters, your people who do the air handling unit will have the laser counters, and you have to periodically check your room. What is the number of particles in a cubic foot of air? And if it has 100, then it's a class 100 room. If it has 1,000, then it's a class 1,000 room. So ideally, on the laminar flow hood, you must check in every place over the laminar flow hood, over the floor, what is the particle count. If it is class 100, ideal for the embryology. And how do you check your VOC also can be checked out in a similar way. So you have to keep the air quality it should be very, very clean with all these parameters checked out. And you have to change your filters. Then the laminar workflow stations are very customized now. We have heated stages in microscopes incorporated. You can have the benchtop incubators, the MINC incubators there, and there are all the positive flow is also metered. There are meters to check the flow. It's a vertical flow, so it's very customized and good ones. So, but you have to keep particle count on this thing. Bacteriological check should be done on the laminar flow, and also sperm survival. These are probably the three important tests, especially if you're not getting good pregnancy rates. Check all these on your laminar flow station. And also minimal lighting. We do not have very bright lights. Try to avoid bright lights and keep the lighting very minimal. Then how do we, as I spoke already, how do we know that the atmosphere is good for the embryo? The best test probably is the growth of the embryo itself. You can culture blastocysts in your lab. Then your lab is, and if there is 75% fertilization, 80% blastulation, then your lab is really good. The other way of checking out is doing a sperm survival, keeping the washed sperms and checking their content, checking their motility after 72 hours. That's the sperm survival. And of course, you have to do your periodic cultures, aerobic and anaerobic. Particles count I already spoke about. Water system, we do have the millipore water system. Now, what is this basically? If you have the RO filter, but if the water is very not good, then if it's very contaminated or a lot of particles, then you have a set of pre-filters before the RO reverse osmosis filters. And then this is relatively clean water, but if you're for the incubator and washing the glassware, you need even more purer water. So you have the MilliQ or the ion-free water. This is preferred. And this system should also be part of the lab. And formerly they were making media. We used to make our own media. At that time, this kind of very MilliQ system, MilliQ water was needed. But right now, we have all ready-made media, so we don't have, sometimes we can do with RO water alone. Then positive pressure in the room, that is the air handling room. A unit will give you the positive pressure, so there's no entry of external air when you maintain a positive pressure. The temperature controls are extremely important. You have to keep the temperatures, keep measuring. You have thermometers taped on to your various warmers, your incubators, and the laminar flow, your fridge. Everything should have the temperature thermometer taped, so that, and every day you should take a reading of what is going on in that, what's the temperature in that system. And it should be graduate. These thermometers should be matched to what you have called a NATA thermometer. This is a standard thermometer which is graduated annually by an institute, and which does this work. And then you match your, you check against this data, compare with the thermometer and see if your thermometers are working correctly. So it's also very important. Labeling is also very important. Labeling and identification are extremely important. Nowadays you have coding and always before you transfer or before you handle transfer an embryo or you do a insemination, make sure that two people check and sign there to make sure the right samples are being either fertilized or right embryos being transferred. And of course, now you have a lot of consumables you'll be needing, right from the egg pickup needle to the embryo transfer catheters, then in the laboratory, a lot of the test tubes, the conical, the round bottom tubes, the non-wells, and then the pipettes and the HC needles, and so many, a big list is there. And always we should have, these should be no, free of embryo toxicity. And hence you buy from a standard place which are already certified, which are not toxic to the embryo. So it may be expensive, but I think whatever comes into contact with the embryo, the sperm or the egg should be absolutely toxin free. That is important. Then your media. Media, again, we were making earlier, but now it's much easier to buy the ready-made media. It started off with a single media, and now it went to multiple medias like flash media, fertilization media, and glass media, and so on and so growth media and all that. Now it's going back a full circle, and now you have a single-step media. So whatever sperm wash, you have the culture media for the wash media and the gradient. So whatever it is, you just check the batch, see that it arrives, the cold chain is properly maintained when it comes, and also check, do a sperm survival, and also note down all the batches, keep track of the batches. So if anything goes wrong, you can track back where which media was responsible. So this is very important, and it should be certified, HIV certified, especially if an album is added. Then the QC, the quality control, is probably the most important part of getting the good pregnancy rate out of this setup. Environment, I already told you about how you check the air quality, the bacteriological absence of any organisms, and the supplies of all the new supplies that come. Just do the sperm survival test. For instance, if it is a new kind of the round bottom tube, you do the sperm, put in the prepared sperm into that tube and check it for 3 days. After 78 hours, 72 hours, check for the motility. And if only it supports that for 72 hours, then you take in and use it. Similarly, the procedures, you should have standard operating protocols. And if there is any deviation from the protocol, should be noted. And don't make too many changes at the same time. If you think something is going wrong and you want to make a change, just do one change at a time and see if it works. If you do multiple changes in the procedures, then you will be at a loss as to what went wrong or what is going right, what corrected the thing, or it may still go wrong. So be very strict about your standard operating protocols and have troubleshooting. Troubleshooting is probably the most important. If you have a fall in pregnancy rate, go back and check everything, right from the incubators, the temperatures, the media, the supplies, and have your air quality check, and have check your stimulation protocols. And it's very important that everything should be checked at the same time for that batch of patients where you can get pregnancies. And so, as I told you, have this as standard operating manual for the clinic, SOP for the lab, and the gadgets and materials should be listed. And the AMC, the authorized maintenance contract, should be maintained for every equipment, right, from your ultrasound to your incubators, to your microscopes, to your UPS, everything should be maintained and should be periodically checked out. And the competency level of the staff also should be periodically evaluated. If there is a fall in pregnancy rate, check back the competency of the person who's handling the embryo. And you should do a maintenance, daily checklist, weekly checklists, and annual checklists are mandatory, and policy manual should be there. So then we can have external audits, we can have internal audits, and of course, we necessarily have government audits. The personnel requirement, I told you, they have to be qualified. I'm talking about the embryologists and the embryology technicians. They have to be qualified. There has to be a backup, never depend on one person. And the knowledge, they should be knowledgeable not only of the procedures, they should not only be skillful, but they should know what is QC, what is in quality analysis, inspection, accreditation procedures. They should be familiar with them. We may not have a lab director and under them an embryologist in smaller units, but the embryologist can be the lab director, supervisor, and also the trainer for the junior staffs. And the responsibilities are for them, apart from their work, is maintaining the asepsis, control of space, and confidentiality. So, of course, very, very important. I work in a corporate hospital, so the files normally go back to the MRD department. But I have got special permission to keep these files in the unit itself. So nobody has access to the files. Training, I told you. And of course, they should be updated. And there should be absolute communication between the clinician and embryologist. They should speak the same language. They must sort out problems together. And this is very important. And there should also be a hierarchy of responsibilities. So as I told you, the clinical director, the staffing will be clinical director, lab director, embryologists, embryology technologists, the housekeeping staff, the maintenance, especially the equipment, the electricity and the water maintenance staff, biomedical technician, and there should be a good front office handling the patients, as well as nursing staff and counselors. And safety, I said about, I spoke to you about fire. There should be fire extinguishers and people should know how to operate them. And in case of fire, they should know what to, of course, safety of the patient and the personnel. But apart from that, the embryo tanks and all those should be, as far as possible, moved away. Short circuits are often the cause of fires. Liquid nitrogen is also to be handled very carefully. They have to wear the goggles. And they have to wear the cryo gloves and wear footwear should cover the toes so that even if there is a spill, there are no icebergs for the people, for the personnel. And also remember, liquid nitrogen is a colorless, odorless gas, and if it's kept in a closed room and somebody is stuck in there, it can become a poisonous affair. And what to do in the case of water also. Has to be, the cleanliness of water has to be checked. And breakdown. Suppose any equipment can break down. So always have a plan as to what to do if there is a breakdown. If your ultrasound is not working during an egg retrieval, if your pump is not working, if the incubator burns off, or if there's a CO2 problem. So have backup plans for every possible breakdown. And also personnel. So, the safety of the personnel, like we said. And yeah, the andrology lab is become very sophisticated now with the computerized semen analysis being available. The work for the technician becomes lesser, yet it does not take away the need for skill. Microfluidics are something which we start using now for IVF patients. But the regular IUI and the sperm wash, the swim up and the gradient techniques, they have to be familiar with. And the phase contrast is a very important equipment still. And then, oh yes, this is the problem of the collection group. So what happens if you just tell the patient come tomorrow for IUI. No, just train them to take appointments with the andrology lab, give them a special number. So they are slotted for at least 45 minutes away from between patients. So there's no rush or waiting or knocking of the doors in the collection room. So collection room also has to be maintained with some basic cleanliness and aesthetics. It ought to have a small urinal and a certain area for collection. And also this hand wash should be available there. All these are small points, but important there. And the theatre, of course, we saw the layout. The pump is a very important pump, and the ultrasound machine are the key players in the theatre. And we should have backups for the ultrasound. And because it can just go take up a fuss all of a sudden. And the pump very rarely goes off, but if you have to, it's always good. But if you can't, and if it goes off, then have the facility to aspirate it manually at least. So the thing then I spoke to you about the warmers, the pass windows. And this is the initial Natalie who came and trained initially when there were no embryologists available across India. She was the one who came and stayed for a month or two and trained more staff. And this was the XC, the stereo microscope. And there are additions, value additions to the existing lab. The pole scope was one, the MC microscope, the embryoscope. But whether we need all this at the basic setup is a big question. There have been no authenticated increase in pregnancy rates because of use of all these. It may be useful for counseling the patient rather than really increasing the pregnancy rates. And I spoke to you about the incubator. You need alarms. The incubators can go off. And I've had experience that the next one morning came and saw there was only smoke there inside the incubator on the screen. And luckily, the embryos there survived. We called the patients and transferred them immediately. So this is something you have to have the alarm system. Your UPS should be checked. Keep the batteries, checked, calibrated, calibrate the thermometers, and have the backup for these. But of course, this never start off with a single incubator. Must have minimum 2 incubators. Having a bench top is also equally good. And they are stackable also. So all can be stacked in one area. Space occupied is less. And the CO2 alarm, CO2 is again important. Your supply is getting it, time your supply, CO2 supplies. And if when connected, when the CO2 falls, you should be having an alarm system to notify that. And make sure your CO2 comes on time when you plan, especially when you plan a batch. And don't keep on the old cylinders because they are little used. Because if you keep the CO2 cylinders standing for more than a month or so, it forms carbonic acid, and it may be one of the causes for drop in pregnancy rates. And of course, the incubator should be under AMC. Warmers again should be periodically checked with the Neta thermometer, whether you have the warm plates, the warmers for where you keep the tubes, all of them should be checked periodically. And the supplies, you should keep the track of all these supplies, the water, CO2, the media, consumables, all of them should arrive on time. You should plan well ahead and not be having heart attacks waiting for the courier on the day of the egg retrieval. So have it well planned, have everything in stock before you start your cycles. And so basically, I just put this, we have this plug there, wash your feet. So again and again, the same thing comes into my mind, that the more you maintain the cleanliness, the air quality, and the temperature, the air, and the pH for the embryo and egg, your pregnancy rates will be steady and give you good results. So with this, and of course, the audit I spoke about, you do your own internal audits. Check out your sperm IUI results every month. Check out your embryology results, your IVF results. Do the troubleshooting if there is a problem. you have an external agency audit you. The NABH audits us, and it's good to have because they pick out things which we may miss. We might have missed maintaining an ANC, or we might not have calibrated a thermometer. All those are picked up, and everything they are in particular about documentation. So have the external audit, and of course now you have the governmental audit, and which is mandatory. You have to send all your data to the joint director every month, and make sure your license is in place, and keep the expiry dates in mind, and be ready for inspection. They may come in any time from the health authorities. All you don't have to clutter and paint on that day. Keep all your documents safe, and just you can be at peace. So audits are important. One other thing is the cryo systems I not mentioned here. You ought to have the cryo cans properly labeled. The cryo room, they should be tagged separately for the sperms, the embryos, and there should be a separate smaller can for the HbS positive patients. And we also have a separate thing. We do fertility preservation, sperm preservation for cancer patients. So we have a separate can. So keep them separated so that there's no mix up. And that's also the cryo system also is important. So with this, I just thank the organizers, and any questions I'll try to answer.
Thank you so much, ma'am. Like very, very extensive, but to the point, as always. I had actually one question. You give your equipment for maintenance to an agency, or from the company you bought, you get the AMC done?
Yeah, I think
Then you can stop sharing. You can stop sharing.
Come on, my thing is not working. Escape.
Yes, ma'am.
Yeah. Preferably you go to the company which you bought it from, because they are in better knowledge of what is your equipment, and the nitty-gritty of it. They will know better than an external agency. And even if it's an external agency, they are going to go back to the manufacturer. It's always ideal to connect with the manufacturer.
How often should they visit the lab for a proper maintenance from the external agency? So how often should they come to the they should come to the lab for the maintenance? The outside agency.
It depends on each equipment, because it's say incubators, we do it every 6 months or so. Microscopes and incubators, probably if you're doing heavy, the heavier your load, the more frequently you do it. The lesser your load, probably you can space it better.
Should every lab have a VOC meter?
Yes, I think VOC meter is not needed. You can outsource it. It's not a difficult. Even the laser counter and the VOC meter can be outsourced. Your person who does the air handling unit will have the VOC meter.
Should we have a separate software for the maintenance of our records? It's so expensive.
Software for yes, it would be an ideal situation if you can convert your entire setup into a paperless clinic and a paperless lab. You ought to. It is quite a. You have to spend on that. That's maybe not for the initial startup, but then as you go on, definitely it's a value addition.
Madam, there are some questions in the chat box.
Charmila, please
Madam,
ask
yes,
them to all to open the video, and whoever is an embryologist, ask them to interact, please. There are about 75 people who joined. Could you request the embryologists who are very upcoming, new people who may be able to give you also some more ideas?
Please open your video so that you can interact.
So that we all can have a good discussion.
The first question is from Dr. Amuda. Which is safe for the walls, ceiling, floor, everywhere? The tiles or PPGC or SS?
Yeah, so actually, there's no study there. I just changed. Initially, I started off with the epoxy. Epoxy was the recommendation. Now, why epoxy? Because epoxy does not have it doesn't emit so much VOCs and there's no gaps. Whereas tiles, you have the gaps and you have to fill it with a grout. But now the stainless steel thing has come in as well as the tiles. And I've seen all the three, they work as well. You know,
There's no
like
difference.
initially when we started off in way back in '93, there was no epoxy or anything. It was only tiles, and we still did get good pregnancy rates. You know, just the same bathroom tiles thing. Then we went for the epoxy. The problem with the epoxy is if they don't do it well, it just cracks and it starts peeling off. And it's a big headache because you have to take out the whole thing and do it again. It's not easy. And
Yes.
so that's the epoxy. But if you get a good epoxy finish, nothing like it. It's easy to clean.
I think the same question has been asked by Dr. Deepti Srivatswa. The material or tiling is best. So Madam has answered that. Dr. Pallavi is asking, is there any relationship between the quality of the lab and embryo fragmentation?
Quality of the lab and
Embryo fragmentation.
Embryo fragmentation.
okay, now there's a lot of embryology questions, I think. You see, each thing that happens to an embryo has a significance. So fragmentation, yes, if your air quality is bad, there will be fragments in the embryos. But what these fragments mean, we really don't know. We have seen fragmented embryos implant and become pregnancies. But if the fragmentation is excessive, definitely, see, it's like two cells when they are dividing, there may be bits of cytoplasm naturally left out. And that may be a fragment that is natural that embryo can implant. But fragmentation can also occur due to external air being bad or the toxins and things like that. So if it's excessive, it's not good. But minimal fragmentation, yes, it can still form an embryo.
Dr. Sumita Lakshmi is asking, what is a basic budget requirement for setting up a good ART lab? Basic budget.
It depends on if you're going with very basic, if you're looking at maybe 1.5 crores, if you just tighten all the corners and I mean, if you're not, you have to add in the rent and all those things. If it's your own setup, you need not spend so much because you have your own space. But if you're renting a space and you're doing it up, all that, so 1.5 crores mostly.
And is the bench top or the box type incubator best?
They're all same, all the studies have said nothing is the best, whether it's a CO2 or whether it's a bench top with the triple gas. Why is it triple gas better? Because thought to be better because it mimics our 5590, which is the composition inside the body. But then you have to realize that 5590 composition has to be accurate. And you have to check every cylinder for that, which is very difficult to keep this quality there. So I would rather stick to our good CO2, and of course, where you can, they are both equally good, I should say. The advantage with the bench top is it occupies very little space and easy to open, close, can keep multiple dishes. That's it.
Dr. Deepti is asking for washing the feet, which liquid should be kept?
Washing the feet, no, water.
Water, more than enough.
See, the basic idea is you shed cells from your feet, the epidermal cells. So you would have walked through so many things and come in your footwear. So footwear may not be really, you don't clean it every day. So that's the idea of washing the feet, getting rid of whatever cell dropping, and you put on fresh footwear inside. Ideally, wear a shoe cover.
Like a temple, wash your feet, then put on.
No, I just put it in there to impress that everything is important, right? From washing your feet, washing your hands, wash your hands.
But it's equivalent, no, madam, like entering a temple it is. So wash your feet.
Yes, exactly. And in fact, it is a temple.
Dr. Preet, are air curtains essential? Dr. Deepti is asking.
air curtains,
Air
if
curtain.
you're in a very trafficy area, if you're, if there's a lot of traffic outside, see, the most important thing is zigzag your entrance. Don't keep the embryology lab or entrance opening into a corridor. Zigzag it so that nobody enters directly coming through the recovery room. So when it's zigzag like that, then very little, air curtains or such things. But yes, even the main entry, if you have a lot of traffic, put in an air curtain. But
So Preeti is asking what's a comfortable size for the embryology lab? Not too small or big? She's giving the answer.
comfortable size maybe around 15 by 15.
Yeah, should be enough. It's
15 by
actually-
15. You can manage with a 10 by 12 also. But the two people will be dashing against each other. One is nothing else. So give little space for that. But having a big lab, you have to clean, more
Very
cleaning and
difficult.
more wiping. More and the air handling unit has to be correspondingly bigger. Your aircon has to be so manageably within a 10 by 12 or so, but 15 by 15 might be ideal. But have the cryo room separate, so then that activity doesn't have this.
Thank you, ma'am. Dr. Jayam, ma'am, you want to ask something? Dr. Suchitra, ma'am?
Kanahi, you just, for the sake of other people, I am asking.
Yes, ma'am.
Clinician is going for a holiday for 45 days. So she wants
Okay.
to not to spend on the laboratory, and she wants to keep the laboratory shut from air conditioning and others. What is your suggestion? Because this
She's
is
going
a
on the holiday.
holidaying. Is there a holiday
Oh.
for laboratory?
He's going to Annamalai.
Yeah, well, yes, definitely. A clinician needs a holiday. There's no doubt
No.
about it.
In COVID times, we all shut our laboratory.
Yeah, we can shut down.
Shut down.
The problem with shutting down is you have to restart the whole thing,
That takes
So when
time.
you come and you're shutting down the air handling, you're shutting down the incubators. These are the two main things you shut down. And of course, it saves a lot of power and electricity and maintenance. But when you come back, you have the thing of restarting the incubators, then doing the culture checks, and then doing the temperature checks, doing the whole thing. That exercise has to be repeated.
So we will prefer the youngsters to keep a basic some person who can maintain the laboratory daily instead of closing the laboratory and going out.
Yes.
Yes,
Yes.
madam.
Second thing
See,
is,
one
will
thing.
you-
I have a question.
Yeah.
I have a question, even
One
during
small
the COVID
one.
times,
You
if you
cannot
had some
just.
embryos,
Hey, wait, Kanagi,
and when you
Suchitra
had-
is asking some question. Yes, Suchitra.
see, during the COVID times, as Dr. Jayam said, we shut down the labs. If you had frozen embryos at that time,
That is
you know,
there separately
how
in
do
the
you maintain
cryopreserved
that
unit.
just for
That
That
is a
is
liquid
nothing to do
nitrogen,
with
no,
it.
madam. That will not be.
Exactly
See, we
what
keep
I
a
was about.
cryopreservation unit separate, Suchitra. The laboratory is separate. That unit cannot be shut down. It has to be
Cannot be shut
60
down
minutes
because
into 24 hours into 365 days
Yes.
into years. That cannot be taken out. That
So
liquid
they take
nitrogen has
turns.
to be maintained, and it has to be suffused with liquid nitrogen always, whether it is COVID or floods or anything. Auntie.
And one more question I have. There is this concept of 5-6 people getting together and starting one ART lab because it's cost effective. In those situations, does a particular lab, say you're owning the lab and there are 5 others wanting to come in, do you have a say in what protocols they're using, or do you say use a standard protocol that I'm using or I'm advising? And as a director, whoever is the embryo director, will he or she have a say in, okay, I don't think this is right, or I think this is wrong, or this is good or bad? So does it work that way? Because otherwise, then how will 5 people work together in symbiosis?
When you get together, ma'am, the understanding is you use a common protocol and you follow, because if something goes wrong, you will not know if one because of the protocol or because of something in the lab. So if you have a standardized stimulation protocol, trigger point and everything, then you can easily troubleshoot if there is no pregnancies or if there's a falling pregnancy rate. And regarding your question for frozen embryos, of course, during the COVID also, we made the andrology people take turns. They have to come and do the filling and measuring and log in the liquid nitrogen. So that cannot
Has
stop.
been done. Interesting, but learned a lot
Kanagi,
today.
would you like to say that
One
it is
question
better
is
that the
there.
laboratory is CCTV connected so that it can have a watch even at 24 hours a day? Because
Yes,
I
madam.
keep it in my cell phone, my laboratory details. At
That's
any time, even
fantastic.
at 11 o'clock in the night, I just look at my laboratory whether it is going all right.
Yes, madam. Definitely CCTV is
CCTV
mandatory.
correct. For the youngsters, I will love to say that please use the digitals also. Keep a
Yes,
camera in the laboratory
And
so
also
that
the alarms, the CO2 alarm especially,
that
and the
if
fire
see, if
alarms. These are
supposing there is somebody in the floor who is to 24 hours there, it is okay. In laboratories which are having only daycare work and in the night only a security is there, maybe he can also go for a sleep. So in which case, this gives us a better support because I'm having it for the past 22 years. My laboratory is the incubator is the working.
always a
There are two
trendsetter.
incubators. The working incubator is shown in my this thing always. Both myself and Priya also is keeping this continuous monitoring. The three of us keep a continuous monitoring on our laboratory.
That was very important because it's embryo requires a nanny, 24-hour nanny to monitor. If not there, we at least do it with the cameras.
Then there's one question from Dr. Deepthi. Can a single ultrasound machine be used for the consulting room and the theatre? I use theatre. Same ultrasound
You
machine.
better have a dedicated one for the theater. And I mean, it may not be very sophisticated high-end machine, but basic, say like
Basic.
Logic is good enough. But have two machines, one for the theater and one is the contamination of moving from OP to theater. The second thing is if your machine fails, which can be very drastic when during an egg recovery, you always have a alternate backup machine keep all your needle guides ready, even sterilized for those. So you can just transfer this machine there and there's no hassle there.
And suppose we are allowing a trainee for 15 days in the lab, is a PNDT registration needed? As such, they will work under supervision only, but still is a PNDT registration needed for that trainee in your lab.
PNDT for trainee for ultrasound?
Ultrasound. Because when you're doing the pickups, it will be an ultrasound control. So do you need a PCPNDT approval for that particular training?
Not for the training. It's so far I've heard like what happened in our in Coimbatore. The new doctor who joins the ultrasound department, that person has to go and meet the JD and show off the credentials. But that's not applied to the trainees. Unless they are
anybody who does the ultrasound will need to put their names in the form.
I don't think they are needed if they are observers. If they are going to do the egg retrieval, I think they ought to have some kind of approval.
All those who are postgraduates, DGO or MDs are all qualified to do ultrasound. So the owner in charge of the ultrasound equipment who has got the registration has to send the certificate of the trainee, whoever comes in, to the health department and as an information. So-and-so is joining me for 15 days for laboratory training. So the credentials are attached with the photograph of the person with the registration certificate. Because as I have postgraduates in me and regular trainees, whoever it is, you just send an information that is enough. More than that, nothing is required.
But they need to know that these people handle the machine. That has to do.
Yeah, because we are sending this, all MD, DGOs are all authorized to handle the machine. If you are allowing a MBBS doctor or an embryologist who doesn't have an MBA, MD, DGO qualification, then the problem comes. When you have a
Madam,
DGO or
suppose,
MD, DGO,
suppose they are
they are all
primary,
authorized to handle the machines for this.
suppose they are dependent candidates, madam. I have dependent candidates. What do we do?
No, if they are handling the mission, the information has to go to the GP.
As, as they are joining the institution, you send the details saying that so-and-so has joined as a trainee. That is very,
Because
very
in
important.
their curriculum, they have 15 days of ultrasound training.
Yes.
In their curriculum, that postings, they have.
It is not about the training part at all. The JD needs to know who all are handling the mission. That's why they're handling the mission.
That is all. That is all.
It is not a requisite for them to undergo the training, but you as the owner of the mission has to give the information that somebody else is handling a mission, because it can be misused for a sex selection. That's why the idea of you need to inform the JD. That's a very valid question, Dr. Deepthi, because we always we try to overcome that, but it should not be done. You need to send a message to the JD office that these people are handling your missions. And Dr. Pallavi has asked how to wash the scan guide device in between egg collections if you have only 2.
You wash it with, see, the basic thing is you should use a very smell, something with a strong smell. Either, your whatever you use for regular theater, betadine, nothing, that's all. You can use a simple smell-free soaps, and you can use it, wash it with distilled water, and do those. You have sterile covers available, so you can use them.
Thank you so much.
I would like to tell Pallavi, if she has got a batch collection of 10 to 15 cases, she should have 4 at least.
Minimum
because
4.
In between can be washed only with saline. Nothing else can be used. After that, you have to use the ultra pure distilled water, which is used for the laboratory work in IVF laboratory. So if you are doing 4 cases, you can have 2 scan guides. If you are doing more than 4 cases, it is better to have extra because it's not that costly and it is reusable. So they should have a couple of more scan guides.
Madam, it's not cheap and all. They are like the scan people, they fleece us. Every probe they can charge somewhere. The guide can be charged from 15,000 to 75,000 depending on your innocence.
If you are doing 10 cases in a batch, 15,000 to 20,000 for a reusable.
75,000. 75,000.
75.
Are you talking about the guides? Are you talking about the
guide only, scan guide only.
It's supposed to be given free.
Okay.
Guide is supposed to be given
what you
free
can
with every
do is a
vaginal
flash
mission.
autoclave. Flash autoclave is one thing, and if you have the facility, do a flash autoclave. That's what I do. Suppose a lot of cases has been, what they do, you should be careful. They just they lose the scan guides, it goes off with the thing. I lost 2 scan guides. So then
somebody must have taken it off. Not lost.
No, they throw it in the bin, with the linen. It goes off with that. You have to be tell them, educate them, this is expensive, keep it safely and things like that. So
my lab staff will always stand next to me to grab the scan guide. First thing she will do is grab the scan guide. Then only she will do anything else. I still can't forget how Saraswati pulls out the scan guide from my hand. But nowadays I'm not going, that's a different story. But still, 10 years ago, I remember how.
If you have a hot air oven, you can heat sterilize them, wrap them up, clean it, wrap it in heat sterilize.
Dr. Madhavita said she has paid 25,000 for a Mindre biopsy.
Guide. Yes.
Madam, because when we are new, we hardly know. So they can charge whatever they want and we think it is expensive and you don't talk to people.
Those companies are another story.
Because every machine you ask one is free. And you have to ask and get it when you're buying the machine. Just because you don't do IVF, what they do, they take the guides and keep it, and then they ask the IVF centers whether they want, and they charge more and get money. Who gets it is a person who's selling from your local place, not the main place. The middleman gets the money for that.
Yes, yes, that is perfect.
I'm giving
As
a
the
great this thing today, news to everybody. Keep be very
Oh, you know
careful
what?
when you're buying an ultrasound machine, ask for a guide and get it free. It is supposed to be given free to you, one guide. And
ask one guide to be paid, 2 guides.
two
You
guides.
can
One
make
you
it
can,
locally also. I got it made locally.
oh, that is another good news. We'll get it for you.
The customer of mine has got all the lathe and everything. So I showed him this. He made one and
And
gave me.
if you are selling your old machine and getting it replaced with another machine, you can keep that guide with you, sell only the machine.
Ah,
They're
Yes,
very
have the guide back with you, no?
yeah.
Yes,
Like,
that's also there, but that is one thing. But when they
That
upgrade
is-
the model, they change the type of guide also, you know. And so,
madam, you have to check when you're getting the machine whether this guide will fit there. Then you
Yeah. When they
Don't
bring
fit
it for demo, I always check everything. Priya also checks everything. And then only because for the theater, we want only a basic model with a Doppler. Of course, not
But
without
usually
a
fits
Doppler.
in most of
With
the
a
guides.
Doppler is enough. We don't want 3Ds or anything. So we look at the guide which has to be there. So we see that they supply the model with that guide.
So only Wallace-on will need a different guide. The other ones are all almost similar. So if you have a Wallace-on machine, you will need a guide specifically made by GE.
All this E8,
will take you
E10,
for a ride.
E11, all those things are different. Now E20 has come, no? All this on 20 has come. Baba, that is not required for our IVF work.
It does not need it.
I think we should keep it basic, simple as far as
Yes,
possible.
that is enough.
Never jump into the
You have a
high-tech
2D ultrasound machine with a Doppler. Basic Doppler
Yes.
is more than enough,
basic.
both in the outpatient and in the theater. Because in the theater, why Doppler? Accidentally you puncture a vessel, you are able to detect it immediately, which is much more important than anything else.
And sometimes the egg will look similar to the blood vessel. The egg will look similar to the blood vessel. So you put a Doppler, you know where the blood is flowing on. Be very
That is
careful.
what is required.
Turn it in the opposite direction and see if it's the thing, even before you apply the Doppler. Madam,
Kaniki,
let me
with
ask
your
you
experience, you will do all those things. And a beginner who is tensed up with, I want to see the egg, I want to get the egg. So she may forget to turn it on the other side.
Ma'am, let me ask you this. Suppose you puncture a vessel, how would you react?
Nothing.
Keep quiet.
Nothing.
Just slowly pull out the needle.
It's
Keep
like a
your hand
venipuncture.
pressed on the side in which you have punctured. Wait for 5 minutes. Just casually talk to others. Don't tell anybody that you have punctured the vessel.
She
5
taught
minutes
me
later-
my pickups, Kannagi ma'am. She stood with me throughout my pickups. Jaya madam.
Yeah. And
And
after
she-
that, 5 minutes later, look at the pouch of Douglas. If
Ah.
it is okay, silently come out.
Don't tell
Because
anybody.
most of the time, it is the vessel in the ovary. We rarely go into ovarian artery or into the other side, big vessels. It is very, very rare. I have done puncture 3 times and quietly I have come out. When you puncture, you can see a sudden flush of blood into your tube, even without yourself pressing on the pressure meter. Even with your pressure of 20, you can see it pump. At that time, slowly pull out the needle. Kindly do not fastly thrash out the needle from the blood vessel. As we slowly pull down, because most of the time, a pulsating one we would have seen. A non-pulsating venous one is the one which we puncture, and it always, nature helps us to close it.
But JM, one question, since you're
Mm.
talking about the needle punctures,
Mm.
if that, when you're taking it out, the ooze is there, the venous ooze takes longer to settle down than the arterial. So when you say
That's why I said keep a hand on the, because our patient is already usually under anesthesia only I do. So I keep my hand on the side of the abdomen, compress. Just keep, because unless it's a very obese patient, in which we'll take all the care to see that we are only in the ovary. Because the ovary margin is so clear, unless we trespass the margin of the ovary, we are not going to come into any major blood vessels. I always say, keep within the margin of the ovary. That is very, very important.
And the path of your needle should be always under your eye. You should
Under
never
our
let
eye.
your eye go away from that path. Then you never miss a
And also one more thing, if you want to come here, on one hand on the abdomen, push your probe also against the sacral probe.
Yes, that's
Like
what I said.
right
Push
hand
your
will-
hand down. That is what.
There is any vaginal bleed, ovarian bleed, and the things. So that's pressure with a probe for 5 minutes.
think we are, it's the first time we are crossing time, and that's because of a very,
Yes.
very interesting interaction. Thank you
Nice
so
to
much.
see 78 people at one point of time were there in this laboratory setup. That shows the amount of interest and eagerness for people, youngsters, to start the IVF laboratory. Thank
you
you,
so much.
Chamla.
Thank
Thank you,
ma'am.
Kannagi. Thank you,
Thank you,
Suchitra,
madam.
for joining
Thank
us.
you,
Thank you,
Dr.
thank you.
Thank you, madam.
sir.
Thank you,
Dr.
madam.
Pandit. Thank you, Manjula. Thanks all of you.
Thank you, madam.
Thank you, ma'am. I'd like to thank the speaker, Dr. Kannagi, ma'am, for joining us and giving such valuable inputs. Thank you so much. I'd like to thank Dr. Jayamkanan, ma'am, who's joined and given her inputs as always. She has been with us throughout this journey. And Dr. Suchitra, ma'am, a special invitee today. And you added, as usual, luster to the program. Thank you so much, ma'am. I'd like to thank all the delegates who joined for this program, because we have almost like, we have seen all of you in each of our webinars. That means we're all constant audiences for this fruitful academic webinar. Thank you so much for joining and giving it so much importance. Thank you. And I'd like to thank the Department of Art, Shield Pharma, who always helps us. Is Chitra there or Sakiti? Who's
Saeed,
joined? Sakiti. Thank you so much, Sakiti, for all your coordination and help. Thank you. We'll
See you
meet
again,
again.